Hello, everyone. Welcome to the IEHP Covered Live webinar. I'm Enid Portuguez, Director of Communications at IEHP. There are a lot of changes coming for Covered California plans, so I'm here with Wayne Guzman, our Director of Sales and Outreach, to shed some light on them. Thanks for being here today, Wayne.
Oh, it's really an honor, Enid, and I'm glad. Thank you for joining us, members. We're excited to be able to share information with you today.
Now, to those at home, if you'd like to ask a question, you can hit the Q&A button on the top right. A panel should pop out, and you can go ahead and type in your question right there. Our team will try to answer as many questions as we can over the course of the webinar. And a reminder, we won't be able to pull up your specific plan details, so please don't include any personal or account information. All right, Wayne, what topics are we going to cover today?
Well, today we're going to focus on really four major areas, and as you'll see here, we want to talk first and foremost what's on everybody's mind. Perhaps we'll talk a little bit about some of the information you may have received, but prices, premium rates. We also want to talk about what's going on with tax credit changes. People are asking about that, wondering what is the facts, and so we want to eliminate some of the confusion around that area. We do want to talk about some of the updates to benefits. We think that's really important that members know what their plans include this year because there have been some major changes. And then last but not least, we want to talk about the areas of eligibility and enrollment. And people wonder how they can get help and if they still qualify for Covered California. So those are the areas we're going to talk about today.
Sounds great. Now, before we dive into these topics, tell me a little bit about IEHP.
You know, I could go on and on about IEHP. IEHP has been serving the Inland Empire for nearly 30 years now. In one sense, we really have become the true backbone of the Inland Empire. And when you think about it, today we represent, with our 1.5 million members, nearly 1 in 3 out of the residents of the Inland Empire are connected with IEHP in one way or another. And last but not least, I would be remiss if I didn't mention our mission. We do consider ourselves the health plan with the heart. And so our goal truly is to heal and inspire the human spirit. And I think that's one of the reasons that brought us here today. We know people are a little bit confused, they're a little bit concerned, and we wanted to make sure you knew we were here for you.
Thank you so much for that overview. All right, let's start with what, like you said, what everyone's thinking about and talking about, price increases. What are you seeing in plan price changes for 2026?
Well, we're seeing the same things that you all are probably seeing, and that is if you've likely received one of these renewal letters, either from Covered California or ourselves. And it's really important to know that these price increases that are being witnessed are being across the entire state, actually. In fact, we'll share a little bit more about why that's happening, but you've probably received one of these letters. And so what I'd like to do is maybe share a little bit more about the region and not just the state, and share a little bit about that information and our plan specifically. What you see here on the slide that we're sharing is a regional snapshot, a highlight of the rates here within the Inland Empire, specifically with respect to our Silver Plan. And we're highlighting our Silver Plan because our Silver Plan, over 80% of our members are in these plans. So you're probably in a Silver Plan with us. This example highlights an individual 40 years old without tax credits. And as you can see in the Silver category, IEHP continues to still be one of the lowest priced options. It's very important to us. And so I'd also like to highlight the Bronze Plan this year because we do have a number of members that are actually participating in the Bronze Plan, and we are seeing some migration as people seek lower price alternatives. So as you see here in this snapshot, the prices within the Bronze category have gone up a little over 13.5%, 13.7 to be exact. And again, IEHP continues to be one of the lowest, most affordable options for individuals who live within the Inland Empire region. We feel this is very important, especially with everything going on. People still need a very, very affordable option in order to be able to provide good coverage for their families. And a reminder, this example is without any tax credits. We'll talk a little bit about that, but most people, in fact, Covered California shares that about 92% of all the people within the state do receive some sort of financial help. So we'll talk a little bit more about what that looks like.
Yeah, let's talk about what you mentioned earlier, because these are big changes. What's driving a lot of these rate changes?
It's a really good question. At the highest level, we know things are going up. Inflation, we hear about the cost of living and the fact that things go up. And in the healthcare space, things go up as well. Technology advances, new drugs, things like that. And so that's very common and normal. But this year, the biggest and most significant driver of prices that we'll go into is the expiration of the federal enhanced tax credits. And so because individuals stand to lose these tax credits because they're expiring at the end of the year, that used to afford them the opportunity to really offset the cost of their care, but that's going away. And I'd like to look at, do a little bit deeper dive in that. But do you have any questions about that?
No, let's keep talking. Tell me more about tax credits. Are they going away completely?
Well, I want to be really clear because a lot of people get confused about this subject. There are two types of tax credits. The original tax credits, which are called advanced premium tax credits, and those are going to stay. Those are the original ones that were started from the very beginning when Covered California Obamacare was launched back in 2014. But the tax credits that are looking to expire are known as the enhanced premium tax credits. And those are the tax credits that were brought out during the pandemic. And those tax credits were brought out to do two things. They were brought out to help with the cost of the care, the premium, as well as the cost of using the care. During that time, it was so important that people still had access to care, affordable access, especially during the pandemic, that those enhancements were made to provide those extra benefits and make healthcare more affordable. But that is the part that we're looking to expire. On this example here, you'll see various household incomes ranging from, say, $40,000 to $130,000. But we're going to focus on a family of 50 earning $55,000. And in this example, what you're going to see is that when you take away those tax credits, so you have the with or without tax credits, but if you're taking those tax credits away, those enhanced premium tax credits, that family stands to see an increase of almost $2,400 a year. It's over $200 a month for a family, and we know that's a lot of money, but that's the impact of the enhanced premium tax credits going away.
Wow. Are there any other changes that are coming? I hear benefits. There might be some changes there.
Yeah, as I mentioned earlier, we think it's very important, and especially for those of you who have more chronic care or more see the doctor more regularly, it's very important to take note of the changes that you'll see here on the screen. First of all, most of our, as I mentioned earlier, the great majority of our members, you are in one of these plans, specifically the Silver 73 and the 87. And so we highlight those because those deductibles, those two top lines in each category, they used to be zero last year. Remember, they were trying to help people to have access to care. It's gone from zero to $5,200 for an individual. That means that medical care would cost them $5,200 or $10,400 for a family. So it's really important to be aware of that. If you're in the Silver 87 plan, that goes to $1,400 medical deductible or a $2,800 medical deductible. The other thing is that we see are with respect to pharmaceuticals and the cost there. Those have gone from zero to $50 for an individual, a deductible, or $100 for a family. And last but not least, the primary care visits have gone up from $35 to $50 in that Silver 73 category. And so we just want to emphasize, again, if you are someone who sees the doctor more regularly, has a more chronic condition, it's really important that you talk to one of our consultants, one of our IEHP team members, or your local agent about this and really find out which plan is best for you this year.
So my premium and my deductible are going up?
Ouch.
Why is IEHP doing this, Wayne?
Yeah, it's it's painful. And the reality is IHP is not doing this. As I mentioned earlier, this is a result of the loss of those enhanced premium tax credits. As I shared, it not only impacts the price of what somebody pays each month, but it impacts the benefits because that's what they were designed to help with. So this is affecting everybody.
Yeah, so all plans.
All plans, yeah. It's a very good point. So we have advocated so much, both at the state and the federal level, to try to preserve these, and we continue to do so. And fingers crossed, there may be something that still happens in the last minute, but at this point in time, this is what is.
Wow. So this is all really great information. And, before we move on, I just want to remind you at home, if you have any questions, please go ahead and hit that Q&A button and type them there. And our team is here to answer them. All right, Wayne, let's talk about eligibility. How do I know if I'm eligible? And, also, how do I qualify for tax credits that you were speaking of earlier?
Yeah, that's a really good question because there's so much that's come out this year. You hear about all these changes in the various programs. And so what we've done is we've listed what some of those eligibility requirements are. Of course, you must live in California. That's a good start, right? And for IHP, you have to live in one of the two counties, San Bernardino or Riverside County. You need to be a U.S. citizen, U.S. national, lawfully present immigrant. And you can't be enrolled for other plans like a Medicare plan or an employee-sponsored plan. Last but not least, you can't be in jail at this point in time. And you do have to have documents. You'll see those on there. It's very important that you have these documents available with you when you enroll. The guidelines have become a little less flexible. Income requirements are just a little more strict, if you will. And so it's important to make sure that you can document that income. And so hopefully this is really helpful to you, and it gives you a sense of what's needed and whether or not you're eligible.
All right, well, we'll get to audience questions soon. But if I'm a member and I have very specific questions about my plan, who should I reach out to?
Well, the good news is we do have options. We're here, and that's one of the reasons we wanted to get the messaging out today. First and foremost, we have a great internal team here at IEHP. Our enrollment specialists and counselors are here to help you during you can 8 to 5, generally 8 to 6. They're here. For those of you who work with our IEHP certified agent partners that are located throughout the communities and the counties, go reach out to them. They are here. There's also what we call health navigators. Those are community-based organizations that assist and help. And last but not least, for those of you who choose to self-enroll, you can go directly to Covered California. Although I would really emphasize, I've been doing, this is my 14th year being a Covered California agent, and I think there have not been as many changes in the program since the inception. So for those of you who may have in the past gone alone, please note there have been so many changes that it doesn't cost anything. A lot of times people think it costs something to reach out to us, but actually there's no additional cost whatsoever to use one of these resources. So I would really encourage you to connect with our team, to connect with your certified agent or that community-based navigator. These people really understand the new changes, the tax laws and things that the health plans, the networks, things that are so important. Yeah.
Anything else you'd like to add? Any tips, resources to navigating all these changes?
Oof. Back to going it alone. If there was ever a time that reaching out to a partner or getting professional guidance, that I would really encourage, this is it. There really are a lot of changes, and there's one thing to be mindful of. We hear people sometimes thinking about, and we recognize it's expensive. These changes have really made it hard, and we know that people are at that point where you may feel like it's the difference between whether I may make a car payment or something like that. But I would encourage you to really think about the importance of health insurance. I go back to before. I've been in the health insurance business for decades, and there was a time when people could not get insurance. If they had a pre-existing condition, they couldn't get insurance. Or if they could get insurance, it was so expensive. So I would encourage you to find a pathway, reach to one of those consultants who can help you, because there are options, and there really are options, and it's important to explore them and to be aware they exist.
That's a perfect segue, because we do have one question that had just came in from the audience, and it asks just that. What other options do I have if I can't afford the new rates?
You know, I could go out real globally and talk about that, but in the state of California, it's important to know that we still have what's known as an individual mandate. Please note that federally, that doesn't exist. So some people think, oh, I don't have to have health insurance anymore. At the federal level, there's no longer a tax for those individuals or a penalty for not having health insurance. But there are states like California, California and others, that do have what's called an individual mandate, and therefore there's a tax penalty for not having health insurance. So when you think about it, if your premium, for example, has gone up $600 a year, I'm just going to say that as an example, the penalty for an individual for not having health insurance is $750, okay? And it's $475 per child, up to a maximum of $2,700. Now, it may have increased a little bit this year, but I would really think about if you can't afford the insurance, but you're going to have to pay the penalty, what's that real difference? When you pay the penalty, you get nothing other than the penalty, and you're exposed, right? You're exposed to all the, I don't know if people have had to go to the emergency room and pay it themselves recently.
Right.
The costs have gone up over the last 10, 15 years. Probably an average emergency room visit is going to cost more than $10,000 easily. Other costs that are there. So let's not go back to the time when people were finding themselves going bankrupt because they didn't have coverage, because coverage is there. So I know, as tough as it may be to feel like you can whether you can afford it or not today, I would think about that difference and figure out, maybe if you have to, just in, the silver plan is, most of our members are in that plan, about 90%. But the bronze plan is there as well. It's a little more affordable. You don't get all the same level of tax credits, but it does help save a little bit of money. And so that's another option that keeps you at least having coverage in the event something more catastrophic was going to happen. Yeah.
Great. Let's check this other questions. So how about, can I add more people to my plan? Will that make it cheaper?
That's a good question. I kind of think, like, how's it cheaper adding more people?
Yeah. Is there a bundle?
Yeah, it's a bundled rates. I have a lot of children and grandchildren, so put them all on the plan. But the reality is, it's kind of interesting. Actually, the cost would go up at the highest level that we shared, but because you receive tax assistance for your household side has increased. And I'm going to step back for a second. When you're wondering about qualifications and just a ballpark, the factors that are really important are, what's your income? How much money do I make a year? We call it modified adjusted gross income from all these various sources. How many people are in your household that are dependents on your counting? How old are they? That's important. And in our case, they all live here in the county. So when we look at those factors, sometimes when you add another child, the cost goes up, but the tax credits, you get more financial assistance. So I'm not encouraging you all to go have a baby boom, but it could actually break even by adding another, but you do need to talk to one of the consultants about it. But it's kind of interesting how the numbers work out that way.
Great. Let's see. What if I don't change plans? When will I start seeing these increased prices?
Oh, very good question. Well, the good news is they actually take effect for January 1st, 2026. Now, you need to enroll typically by December 15th. in 2025 to have coverage for 2026. So that premium payment, that cost of that insurance is due before that December 15th so that you can have it. So if you're looking exactly when, they take effect for January, but you need to pay them ahead of that so that you can be covered for the new year. Yeah.
And
That's a
if
good
you
question.
are a new covered IEHP covered member, do you have until those same dates as well to sign up?
Yeah, they are the same. Some of you are renewing today, and you've been with us, and you're looking and looking at those options that you have. Those of you who are new to IHP, those timelines are still the same, and so welcome if you. We look forward to being a member or having you become a member with us.
Let's see. When is the last day I can make any changes? You talked about it again, but I guess it's good to reiterate.
No, because actually there are two timelines that you need to be aware of. The first one is if you want to have coverage by the first of the year. That has to happen, and those changes need to be made by December 15th. The actual open enrollment does extend to January 31st, 2026. Anyone who enrolls after December 15th up until January 31st will have a coverage effective date, or your coverage will be effective on February 1st. So you have all the way until January 1st for that period to enroll and to make those changes or add that coverage. Yeah, it's a good question.
Yeah. All right, last call. If anyone has any questions, please go ahead and put them in our Q&A section, and we'll also have our team here a little bit after the webinar ends to keep answering some questions. And one other question, which you did kind of cover, was, do I get penalized if I don't have insurance?
Yeah, just to reiterate, there is a requirement to have health coverage in California, and there is a penalty for not. It's a tax penalty that you would pay when you file your taxes. For an individual, it's $750. Per family member, it's $475, and I believe that's up to $2,700 maximum. So that is a lot of money.
Yeah.
So yeah, it's a very good question, and we can't say it enough. It's especially as people are thinking, I'll just go without, right?
Yeah.
So yeah, it's a good question.
Well, this has been so helpful, Wayne. Thank you so much for your time and for guiding us through all these changes and answering all these questions. We've put some information up for how to reach us here at IEHP. We have our website. Call us, our enrollment services line, email us. We're here to help you. And
Yeah. Hey, one thing I would note, Enid, is just very clear. We probably should have bolded. 8 to 6 is when we're here during the week. So we're only open for a few more minutes tonight. So, but we'll be here first thing tomorrow morning for you. So yeah, good question.
Great. Thank you so much for joining us today, and we're here whenever you need us. So feel free to reach out if you have any questions after this webinar.
Thank you.
Thank you.
Good luck to you all.